Hello everybody, this is Dr. Raj Laxmi and welcome to all of you on our first live Instagram session. Today I have with me Dr. Jaya and she is a leading expert about, she always emphasizes on visceral manipulation, osteopathy, and today we are going to discuss about the benefits of visceral manipulation on neck and digestive distresses. So Dr. Jaya?
Yeah, so as we all know, viscera includes all your organs. Basically, viscera means your organs. So it was derived from the Latin word, which was it's viscous, which means organs of the body. So visceral organs are basically mainly the organs. So visceral organs are mainly the organs of the two major cavities of the body, namely the thoracic, that's your chest cavity, and the abdominal cavity. So we all know, like, thoracic cavity has our lungs, and we have the esophagus passing, the stomach, and then the abdominal cavity, which has our intestine, liver, gallbladder, pancreas, for the women, the uterus, male prostate, and the urinary bladder, kidneys. So all these are the abdominal cavity, which everybody knows that they are like very, very vital for our survival. So visceral mobilization is basically a manual technique which is used to improve the normal mobility of the viscera in relation to the surrounding tissues. So even like how we can move our limbs, the viscera also has its own mobility, which is again related to the surrounding connective tissue, which means myofascia. So we all know these days we talk a lot about myofascia, but many of us believe that it's only concerned to the limbs, to the muscles, but we don't know that myofascia is like a jumpsuit. It's like a suit. It's like a suit that starts from down to your foot to top of the head. So even the viscera is actually covered by the fascia, and the fascia holds our organs nice and firmly where they should be and promotes its mobility and motility. So there are various conditions that we use the visceral manipulation. So it's like acute disorders.
Yeah. So like if you have any whiplash injury or sudden injury which you have, or if you have a traumatic brain injury, it can be useful. The visceral manipulation is very useful in those things. Also in the basic things, the digestive tract.
The digestive system. It's really helpful. Yeah.
So if you have any bowel movement dysfunction, or if you have any digestive distress, so it is very helpful in that. And also mainly where we use it's in women and men health. So PCOS.
It really helps in women. I mean, it's like a huge change. It can actually bring to their. We have been working with a lot of cases with PCOS. Where they have really helped women, to be like we all know, like PCOS has women do suffer from like a lot of dysmenorrhea, like pain during their cycle, which it has really helped to calm it down, and of course it has helped them to promote the cycle. The regularity of the cycle has actually improved. Yeah.
It has also helped in male, in fact, if they have any testicular dysfunction or if they have any prostate dysfunction. So it is very helpful in that as well.
Yeah.
So they also, it is since these small organs are also working, it also helps in your peripheral system as well. That means if you have any sciatic pain or if you have any musculoskeletal pain, that means if you have any muscular pain, so it is also very helpful. It is interconnected. We are going to explain it to you. And it also helps in your neck pain, which we are going to discuss about it. Also, it also helps you in pediatric conditions. That means small children, they have sort of digestive problem. They keep on vomiting and all. So visceral manipulation is very helpful in that. And yes, the most important thing, the emotional ones. So yeah, emotional issues are also like anxiety or depression if you have. So it is very helpful in that.
Yes, it does work like amazing for the pediatric cases, even with the kids. It's really helpful. Yeah. So we all know, like, now we would like to discuss a very important thing, like how viscera is basically connected to our neck pain, because we these days, or generally we hear like a lot of people do complain of neck pain. You work a lot on their traps, on correcting their mechanics. You want to, stretch their pectorals, give them all postural correction advices, but they somewhere, they keep coming back to you with the same repeated issue that they're still not able to sort out their neck pain. They're still complaining of the same discomfort that, and on top of everything, it does radiate to their arms as well. So the neck muscles, like your sternocleidomastoid, your traps muscles, they all are supplied by the nerves which are arising from C1, C2, C3, and C4. So they're the they're the value, like from where which nerve supply what. So the root course of our phrenic nerve that supplies our diaphragm is also C3, C4, and C5. So this sharing of the nerves of the diaphragm and the neck muscles, this causes the interconnection of the pain between the diaphragm and our, the pain that the patient experiences or a person experiences in the neck, or maybe, radiating down the deltoid. So which means that if there is any distress in the diaphragm, then the neck muscles will tighten up and would lead to pain, and vice versa. So if if you are experiencing like your neck pain, then it's your diaphragm that's coming under stress. And it's very commonly seen in the marathon runners, or these days, like a lot of people have took up running, as they're in COVID times, we can't go to gym. So there are a lot of people who have been going for the runs. So they have been really complaining of a lot of neck issues. Suddenly the neck pain has come out of nowhere. And yes, so this can be one of the reasons why the neck is kind of troubling you. So please get your diaphragms checked.
Yeah. Also, this is your helper muscle for your breathing. Right, your neck and your diaphragm, they are the helper muscles, the main muscles that help you in breathing. So if this is activated, this is constantly working, and if it is pulling yourself down, so again your neck muscles also work, they also tend to overwork with it.
Yeah, so it actually changes your mechanics, because diaphragm is getting constricted, it's pulling you down, then again you lead to a forward neck posture, with every physio I believe would be talking about that, don't run with the forward neck and don't run with the stiff shoulders, but that can be one of the reasons that it's actually altering your through the mechanics, and restricting your trunk rotation as well.
Especially in this time, I've seen where we have to analyze the running posture of the patients, of the athletes. So because they are constantly, they're not breathing properly, or they are wearing mask and running.
Yes.
So what has happened is they have started hunching more. So the postures which I had seen earlier before the lockdown and the postures which I'm seeing later on is completely different.
Completely different. The assessments, that's what, the cases, the marathon runners or the runners, they have been more often now coming up with these kind of tightness. And yes, and once you work on their diaphragm, and they're getting like amazing results. In fact, their performance is going up. They're really, we've seen the performance, the speed, and the endurance has kind of improved for them.
Yeah. Okay.
So we would like to now go to the second topic, which is about your digestive distress. Yeah. I believe every one of us, has experienced these problems, these issues in today's time. So this can be your bloating, your constipation, your acid reflux. A lot of people tell us like they can't sleep straight. They have been using two pillows and propping them up because they're facing this lot of reflux. So yeah, so because of which they can't sleep well, and again they lead to neck issues. So ultimately, everything is kind of connected. It's like a vicious circle. So it's your intestinal motility disorder. Yeah. It's nothing but it's your intestinal motility disorder.
So motility is the movement of your organs. So if it's like how can you say, it goes like this, like an earthworm, it goes like this.
It's like a wave pattern. Yeah. It needs to move like a wave. So they have their own movement inside. It's called motility of the organs. So if there is any intestinal contractions, such as spasms or intestinal weakness, like many times doctors would actually be talking about that the bowel is not moving well. Yeah. They say that your bowel is not moving well. That's why the constipation problem persists. Like it's a persisting issue with a lot of people. So they do make a lot of dietary changes, but still somewhere they still do complain that the constipation is somewhere not being sorted. So yes, it's your motility of the intestine that's not being able to improve. So because of the weakness, but again, if we do mobilize or we do manipulate the intestine, it can help you out with this issue. So yes, there are other variety of disorders as well in which your gut, which we say gut,
Gut
you know, the
feeling.
gut feeling has
Yeah.
lots of ability to coordinate with the muscles.
Yeah. So it also, if you see your stomach and your moods or your head, it always has an interconnection. So if you're not feeling good, if you're not evacuating yourself properly, so you won't feel, you'll feel lethargic. You won't feel fresh.
Yeah.
And also, like she said, that I have a gut feeling. So if you're confident enough, you say that it is in my gut. I feel it in my gut. Also, if you're nervous about something, or if you're not scared about it, so you have butterflies in your tummy. The word butterfly in your tummy.
Yeah.
So from there you can correlate that your stomach and your brain is always connected. So any anxiety disorder, any depression, you always take a good look in your intestine and your stomach. If you have any problem in that, you just check on that as well.
Yeah. So if we do work on the intestinal mobility and manipulation, so yes, somewhere we can, I guess you can be helped out. That it should not be such a great issue for you, and there would be, yes, you would be, I think, much more a happier person, because as she said, you really need to go, and you feel much better when you relieve yourself in the morning, as she nicely said. So yes, if your intestines are working well, it plays your anxiety, your depression, you're a more unhappy person. So ask your physio again to check for intestine whenever you go and visit them.
Yeah. So also, like you are always focusing on women health. So
Yes. So in women health, as I said previously as well, that we had been working a lot on PCOD cases. So we all are aware, like how important is your pelvic floor. We have been lately, a lot of people have been talking about like how important is the pelvic floor muscles, their strengthening. Everything really plays a very important role. But before that, we need to understand about a little bit about the endometriosis.
Yeah.
So endometriosis, it can often affect your abdominal organs, causing scarring and decreased abdominal organ mobility. Again, we're repeatedly using the word that every abdominal organ has its mobility. So if there is endometriosis, so it leads to decreased organ mobility. So this can result in your abdominal pain and often complications like intestinal obstruction, bloating, you don't feel well inside your stomach. A lot of women complaining that before they get their menstrual cycle, they are like completely bloated. They don't feel like eating, and they don't feel like doing. A lot of fatigue in their body. So let's now try and understand that how pelvic floor physical therapy can help with managing the symptoms associated with the endometriosis. So it's a chronic pelvic pain that can affect your body posture, it can affect your muscle tone as well as alignment. So again, as we said, it doesn't lead, your muscles don't function well if you're into too much of distress. So if you're not functioning well, your core will not fire well. So if your core is not firing well, so again, if you try to, during that time, you try to exercise or something, you get more prone for injury. Because somewhere you can't really fire your core to its 100% that you should be doing it. So muscles become more shorter and tighter and misaligned due to the perpetual responses of the body to the pelvic pain. So all these things are very much connected. It's like a vicious circle. So we really need to address to all these issues. You can go to your pelvic floor physical therapist or physical therapist trained in your visceral manipulation. So basically, they will help the patient to relax her body and restore the balance and the alignment. So while the pain will emanate from the pelvis, but the effects of the chronic pain are far more reaching due to the role of the pelvic floor in the core activities, such as your movement and coordination. Because if your core isn't, as I said again, I'll repeat again, because if your core is not firing, you lead to your back pain, it leads to your upper shoulders pain, chronic rhomboid strain, neck strain. So basically, it plays a very vital role.
So we have a question over here. Can this also help in low back pain?
Definitely, as we have been repeating that if the intestinal motility is not good, or in women if she has an endometriosis, so if your organs are not moving well, so as I said in the beginning itself, the fascia is connected. You know, it's like a jumpsuit. So if your fascia, which is covering your organs, that's not moving well, so it's definitely going to affect your back spasms as well. So if you help your mobility of your organs, is definitely going to help your back pain. Yes.
So, shall we? Will you show us?
Sure.
Yeah.
Sure. So I would like you. I like to show a diaphragmatic technique, like how do you release the diaphragm, which works very effectively in your upper back pain, your neck pain, and to improve your digestive disorders, acid reflux, and because your diaphragm is very closely connected to these structures, to the inferior vena cava, to your esophagus, to your stomach. So we definitely need to, target the release of the diaphragm, and you would see a great improvement in your low back pain, mid back pain, and your neck pain.
ये तो सीधा ले चलो। हाँ, शूज उतार के। So can you explain it to us where we can find where?
Sure. So for the diaphragm, we know that we would go and palpate the lower end of the sternum. So sternum is our chest bone. It's the lower end of the sternum is your xiphoid process. So we don't have to press on the xiphoid process. These are the lower end. Will follow the lower end of the ribs. So as we can see, these are the lower end of our ribs, the false ribs. We have these floating ribs as well here, and this is the top portion of our lower costal margins. So I would be placing my hand around the lower costal margins first, just to palpate where exactly what is happening. So we would just monitor his breathing. Then how is he breathing? Is he breathing well in his right lobe, or is he breathing well in his left lobe, which has more of expansion? So I can feel that he's breathing very well on his right side. I feel some kind of facial restriction happening on his left side of the diaphragm. So we're going to palpate where his restriction is. And as we palpate, I feel a slight restriction over there. So I'm just going to hold that, and I would call for his breathing. I was asking him to breathe in and slowly breathe out. You need to relax your hands. Keep your hands straight down, palms up. Try to focus more on the left side of your ribs. So it's a very gentle technique for the diaphragm. So as we hold and give a slight stretch, we feel that the tissues would give in. And I already feel that there is a softening there, and he can already breathe better that side. So in the COVID times, when people have been suffering with a lot of breathlessness, anxiety, this technique would help them. They would feel suddenly lighter on in their breathing. They would see as if some load has been off their chest. There's one more technique where we would go deeper into the tissue, into the lower dome of the diaphragm. So right there we have the liver resting under our right side. So this sometimes mobilizes the diaphragm, the liver itself. So people would suddenly feel that increased digestion suddenly improves.
Right.
But I always prefer going down like this. So this is like you're tapping their core with the diaphragmatic release. And after this, there's some people who actually feel that they're able to fire their core much better after releasing the diaphragm. Okay, take a deep breath. Inhale, 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 exhale. Good. Again, inhale. Now we see a more expansion on the left side. Again, take a deep breath in. Very good. Relax. And along with that diaphragmatic release, we can also call for the hand movement and see how it affects. So I would like you to lift your right arm up. Can you lift your right arm up? Good. And bring your arm down. Niche leo. Niche leo. Lift your left arm up. Take it back. Good. Bring it down. Now do it for the right side again. Just the way you do it for the good. So now I can feel when he's lifting his right shoulder, there's some restriction on his right side of the diaphragm with the arm lift. And come back. Good. I would like to work on his right side because I find his shoulder movements are restricted with the right. Move it up. Good. And down. Once more. Down. And now relax. Good. That's much more softer. So some people do experience some kind of soreness after this, but you don't really have to worry about the soreness. Just ice it, and the soreness would go down.
All right.
And they would, in fact, feel much more lighter. Thank you, Vikas.
Okay. So, would you like to show the stomach as well? Intestine, sorry, not stomach. For digestion.
So why don't you show Dr. Raj Laxmi? It would be amazing to see you working.
Yeah.
Yeah?
All right.
Teacher.
Okay. So for intestine, we divide it into three different quadrants, as they say. So this is your upper, this is your middle, right around the umbilicus, and this becomes your lower quadrant. So for upper quadrant, usually when you have acid reflux, so the GI tract is divided into upper GI tract and the lower GI tract, right? So if you have acid refluxes, if you have vomiting sensations, so it is usually considered in the upper side of your stomach. And if you have constipation or loose motion, it goes to the lower side of the GI tract, right? So for the upper side, you place your palm right under your diaphragm. Breathe and start applying a little bit of pressure on it.
So it's a very gentle technique where you go first try to listen. So this is something that you need to first listen and see if your mobility is good here or no. So once we assess, we find out like which is the area of the intestine that's more restrictive. So is it your upper part or the lower part?
As you can see, he's letting me go deeper after each repetition. Right? Same thing goes in the middle quadrant. So you place it that direction. Okay? Take it. So you feel the patient. If you have, so always touch your stomach from everywhere. Where do you find tightness or soreness or tenderness? So if you feel that if I'm touching over here, he's feeling tenderness. So that means you have to get it released immediately. Right. So right. Breathe in and breathe out. You always have to take care of the aorta over here. So if you place your hand over here and feel that you feel there is
A pulsation or a palpitating
or a heartbeat sort of thing. So you have to take it off immediately. You don't encourage in doing that.
Yeah.
Right?
And it does help in your irritable bowel habits and persistent constipation. And we do have a question here, Raj Laxmi, that will it help in irritable bowel habits and persistent constipation? And can he do something about it by himself? Like if you can just tell about the self mobilization, that what he can maybe do, or a gentle massage, what he can do in his stomach.
So in there, what you have to do is just place your hand right here. Okay, यहाँ पे ऐसे रखना है and just ऊपर खींचो, relax कर दो. इसे दबा के ऊपर करो, फिर relax करो. ठीक है? Slightly you can. But I would suggest them that they first assess them. You come for assessment. You can go to your physios, assess your bowel. You can ask your GI doctor as well if they give a clean sheet that you can do it on yourself. Then you can go. You have to learn this technique for yourself, because the way I touch you, the way I touch a patient is different from what a patient will do it on himself. So they tend to do it.
Yeah, do not overdo it, or excessive pressure should not be put. So otherwise you can just go for a gentle massage, abdominal massage, like in a circle, but go only in one direction of the circle. Like do not go for the, so you just have to go like one direction circle. So not like, first this and this, not like that. So just follow like clockwise direction like that. That's it.
Okay.
And so we have one more question, like how often can one can take this treatment, and is it painful? So as we say that and you can go for this at least like once in a week to twice in a week, but depending, again, it would depend on the assessment that you would go through. And if you feel that it's too restrictive, then yes, twice in a week is sufficient for the viscera to be mobilized, but not every day. Every day is not advisable, because you have to give time for your own system to heal. And it's not really a painful technique until and unless it's very restrictive and the person is very tender. But as I said, first you need to listen. We need to listen to the organs, what they are saying to us. So we start with being very gentle, and the patient has to kind of let go when we do this. And if they let go, then slowly and gradually it becomes more comfortable for them, and they let you go further into the system. So yes, it is. It might be painful if the patient is resisting it. It becomes painful. Otherwise, no, it's not a very painful technique. No. But as I said, you do get sore because you're using your hands sometimes, and so you can definitely take an ice bath for that.
We have one more question. It's can it help in weight loss?
So I would not really claim that it helps in weight loss, but if we going to see indirectly, yes, it would affect your metabolism because you're helping to improve the motility of your organs. All those people who get bloated, so sometimes the weight is because of the bloating. So for them, it helps because the bloating goes down, and when you work on the viscera, they actually look more toned up, surprisingly. We had few patients and we worked on it, and suddenly it's like, oh, what happened to me? Suddenly it's all like nice and flat. Yes, they look completely a different person. Sometimes you feel there is a sudden change in their expressions. They're more happy, they're more lively. So yes, it does affect, as we explained, from your anxiety to depression to being feeling good about yourself to bloating to eating well, the certain kind of food which doesn't really help you. So it does help in your digestion, definitely. Yeah.
So there's one question: can I do it to my family member, or does it require only help of from a physiotherapist? Yes, because we have been taught where the organs are, where how much pressure is supposed to be applied to it, and like she said, you have to listen to the organs. That's exactly what we are being taught. At first, you listen to the organs, whether um, you know they are sending a wave or no. Wave in the sense is not just wave, but yeah, how exactly it is functioning. If the wave is going from left to right and you're going from right to left, then again it's just going to cause problems. So yeah, you need to be a certified therapist to work on it.
To work on it. Not everybody can work
Yeah.
on it. And if we all remember, in olden times, we didn't have MRIs, we didn't have CT, and all the physicians and the doctors and the Ayurvedic doctors still, they do work is they have the listening hand.
Yeah.
So a lot of people say, oh, uske hath mein shafa hai. So it's actually their hands are their proprioception is so good that they can listen to the organs, what's happening inside. Yeah.
All right. So if you have any questions, queries, please let us know. Okay. Is it same as the naturopathy called the Nabi Kiskana? Well, sort of, you can say, but
Yeah, I mean,
yeah.
like,
How can I explain? It's like a raw term, and
Yes.
Since science is a thing that it has evolved a lot. So it has been properly
So
polished and all.
before we had orthopedic doctors, they were bone setters, right?
Yeah.
So they used to do the khicha or kandhi ko theek kar diya. So it's like you kind of fix it, yes,
Yeah.
but you don't know what you're doing inside, what damage you might cause it.
Yeah.
I mean, you're not qualified to do that. So
Yeah.
it's something that people do these techniques where they say कि नाभि खिंच गई है या धुनी उतर गई है धुन उतर गई है. So they have these techniques where they kind of in fact my nani and my dadi used to do it. They used to tie something around
My mom used to do that.
around the big toes, and they would pull it and they would say, oh, तुम्हारा ठीक हो गया, तुम्हारी नाभि खिसक गई थी. Yes, so it does. In olden times, they used to talk about that, which most of the things have carried up. Now we have carried it on by after doing a lot of researches and stuff. So yes, it's about the intestines not working well. That's what they would say कि नाभि खिसक गई है. So yeah, they almost do the same thing, the naturopaths. Yes.
Also in Nabi Khiskana, you always see whether there's a heartbeat inside in your
Yes,
stomach or not.
yes.
And then you push it. So yeah, if you feel that we have to, take care of it, we don't push it just in a go. So that's what I was saying. Ki, you need to be polished about that. ऐसे नहीं कि पकड़ के, you just leave it like that.
So there's like 0.1% chance or somewhere. Those who are expert, maybe for them there's a 1% chance that sometimes you can cause a damage to
Yeah.
it. So you just be careful when you do that. So we have one more question. Like, can it help females in menstrual pain? Yes. it can definitely help women in menstrual pain, because as I said that every organ is covered with the fascia, and if it's the fascia is tight, the organ is not moving well, so it's like a constriction. They're facing a constriction, you know. So if I hold her hand like tight, I don't let her hand breathe, so she would finally experience pain, right? So it's the same thing. So if the organs are not working well, that's the reason why you land up having menstrual pain. So if you do the visceral manipulation for the uterus, so yes, for the broad ligament, you do release those broad ligament, yes, the menstrual pain does go down. Definitely. In fact, there are a lot of females, they would complain of pain radiating down their leg. So even that pain kind of goes down if you work on the viscera. A lot of people with PIVD, they would say, oh, during my cycle, my pain again comes back, my sciatic pain again comes back. That's only because your viscera is very tight, and that's what causing more pressure on your discs.
So there's one more question from Mrs. Shalini. I had a C-section. Doctor says I have scarring. Can you help?
Definitely. I guess today the answer for everything is yes, we can definitely help you out. Because if you have a C-section and there is your incision, they put right below the umbilicus in the absolutely lower quadrant. So that's the place where our deeper core lies. And if your scar tissue gets formed, your deeper core doesn't fire to the extent that it should give you stability. It's not able to fire, so it doesn't give you stability, right? So we need to release those scar tissue, which is adhering to your deeper core, and make your organs move again very well, so that you're able to fire your core again. You can learn that core firing, and I will advise to every woman that immediately after the deliveries, after your incision is healed, your stitches are healed. So please, after like 6 weeks at least, start doing your core strengthening, mobilize your scar. Do not be scared to touch your scar. It's very important. Like, I still find so many women, they're like scared. No, don't touch my scar. I had a scar. It's okay. You need to mobilize that scar. It's a scar that's not letting your muscle work, and as a result, you would get your less toned stomach. Your belly button would always be hanging down, and then after that, you would have a lot of stress coming up to your spine. So it's going to ultimately affect your disc, and your radiculopathies would start, your nerve would get irritated. So please take care of yourself in the initial 4 to 6 weeks after you deliver your kids. Yes.
Okay. So hello doctor, how often does one have endometriosis require this treatment? So she wants to ask with how many treatments does she need? She has, surprisingly, nobody is asking about neck pain. So we are very curious females over here. Yeah, I think we should have another session for
the endometriosis in itself, PCOS in itself.
Yeah.
So I would not recommend like there are 10 sessions of physio that you need and you would be fit and fine. Again, as I said, it all depends on our assessment. So when we assess the mobility of the organs, so that would decide how much adhesions are inside that are restricting the mobility. So we might be able to help you maybe in 3 sessions as soon as that, or it might take you like say around once in a week if you take the session, maybe like 4 weeks or 6 weeks. So it depends how often you need those sessions and how badly the organ is stuck inside.
Thank you so much. That was a nice thing. Does it help in abdominal hernia? This technique is used for loosening your body, and hernia is where you have to tuck yourself inside. So there are no research work. There is no research work done where there are suggesting that abdominal hernia is useful with visceral manipulation. So I wouldn't say that you go for it. You can start with your core exercises for your hernia, And I think if later on something else happens, like if you have any other problems like constipation or something, then for that you can use the
Yeah.
visceral
So we'll not say
manipulation.
that it helps in abdominal hernia, because again it depends on how big is the hernia, like how much
Yeah.
apart it is. So I think we would need to take a call after seeing the investigations.
Yeah. So thanks for explaining.
You're most welcome. We're glad we could help.
Yeah. So if you have any other queries, you can always join to AOSM_India, and you can share your comments. You can contact us. We'll be very happy to answer to your queries. And stay tuned for our next session. We'll be talking about osteoporosis on that, and it will be after one fortnight. Hopefully on Instagram, or if not available, then definitely on Facebook. Right?
And keep following us for the subsequent posts about our
Yeah.
visceral manipulation.
Okay. So before we go, I think we have some questions as well. There is a dull ache always in my right shoulder blade and neck. Need help.
So again, to start with, like if you need help, then you need to contact your physio first. He needs to assess you well. So as we say, for the neck pain and your pain under your shoulder blade, so the physio would assess you whether as a whole. The physio should not just work only on your neck or the shoulder blade. And he or she needs to check your rib cage mobility, like how well you're moving in your ribs, how well are you breathing, are you using any accessory muscles or no, is your rhomboid strong enough, is, as we say, is your diaphragm working well, is the mobility of the diaphragm is good. So yes, if he or she kind of works with the diaphragm, then yes, the results would be very good, and 100% you would be sorted.
So there's one more question. My brother had jaundice. Can it help? Again, the answer is no, because in jaundice, your liver is again stimulated.
Yeah.
It is giving out its juice more. So if you release it, then again it is going to increase the level of your juices.
Yeah.
So no.
So not during the jaundice.
Not during the jaundice. So if he had a jaundice for say a year ago, then yes, you can go for it. But if it is like in 6 months, so I would say not now.
Let's wait. Show to your physician, and let's see how is everything. Like organ wise. If your physician gives a clear chit, then maybe yes.
That's it then.
So thank you guys. Thank you for joining in, and please follow us for the subsequent posts. And if there's anything, please contact us at our AOSM page, and any other queries, feel free to message us.
Yeah. So thank you, Dr. Jaya.
Thank you so much.
Very informative.
Thank you so much, Raj Laxmi. Thank you for your great support.
Thank you so much.